Hello viewers, welcome to this episode of Healthy India. And today we're going to talk about a problem of the gut, our gut. You know, the gut is a silent worker, behind the scenes, behind the curtain. It digests our food, absorbs the nutrition, throws out the waste, and in general keeps us feeling good and healthy. Even a minor disorder of the gut can play havoc with our day-to-day sense of well-being. One of the most common disorders of the gut that everyone is familiar with, it is thought that maybe 25% of the world's population has suffered from this at some point or the other. I think the figure will be much higher for Indians actually. But anyway, is constipation. So constipation is one of the commonest conditions affecting the gut, and I'm sure our viewers, many of us can immediately connect with this problem. But the textbook definition of constipation still remains passage of less than 3 stools a week. I mean, if you're passing stools every alternate day, that is more or less considered normal. Is that correct? What actually should we be looking at in constipation in terms of when is it serious, when is it just trivial, what should we do, how should we save ourselves? And we have 2 of the country's foremost experts, gastroenterologists with us today in the studio to talk about this problem. Dr. Anoop Saraya, Professor and Head of Gastroenterology and Human Nutrition at the All India Institute of Medical Sciences, and Professor Gourdas Choudhuri, who was formerly Chief of Gastroenterology at the Sanjay Gandhi PGI Lucknow and now heads the Fortis Hospital Gastroenterology section in Delhi. So let me start with you, Dr. Saraya. You know, firstly, this definition, you want to give me a line about the definition? Because most Indians would say they're constipated if they're not passing stools twice a day, maybe.
That's a common perception, in fact. In India, if anyone is not passing stool in the morning, he'll say that he's constipated. Then any discomfort in the lower abdomen, they attribute this to constipation. So it's more of a perception. But as far as definition is concerned, if we go by perception, then the incidence of constipation in Indian population varies from 25 to 53%. The study which was carried out in Lucknow that showed that almost 53% of rural and urban population, they suffer from this perceived constipation. So actually, if we go by definition, that's a Western definition, less than, as you rightly said, less than 3 stools per week. If we go by that definition, then definitely the number will be less, and it is around 11%. Apart from that, if we define constipation, there are certain features which we have to look into. One is stool frequency, number 1. Number 2, is there any urge? If the patient is feeling urge all the time, if he is feeling obstructed, all these features are important. Or he is taking it out digitally. Sometimes they are not being able to pass a stool. So all these features are also equally important, and we should pay some attention to that also before labeling anybody as constipated. And pain abdomen, as far as pain abdomen is concerned, people are very worried and they say that they are constipated and they are having pain in abdomen. But pain is not a very important feature of constipation. May be important for if patient is having obstruction due to some reason, but definitely that goes more in favor of a functional bowel disease, which we say irritable bowel syndrome.
So typically constipation means that you're not able to pass stool, and by the textbook you would still say it is less than thrice a week, right? So what other clinical features? Hard stools?
Hard stool.
Painful defecation?
Painful defecation.
But not pain in the abdomen so much, right?
Then because of constipation, patient, they may complain of lethargy, weakness, sometimes nausea, sometimes vomiting also. So these are other symptoms. And the quality of life is definitely affected to a great extent.
So that, of course, we know that quality of life is impacted to a great degree by constipation, and it's more in women and more in the elderly, right?
More in elderly and more in women.
So,
And another important factor, patient may be having some other illness, like patient depressed. If he is depressed, then also chances of having
Yes.
constipation more. So that depends.
so Dr. Choudhuri, you have tons of experience with this condition for decades together, treating and answering questions from patients. I run an endocrinology service, and at least 50% of my patients will say that they suffer from constipation. So, what is significant? When should a patient worry about seeing a doctor? You know, everyone says they are a little bit constipated. What should take us to the physician immediately?
So, if your term is immediately, there are certain what we call as alarm symptoms. And if it is a constipation which is associated with, say, blood in the stools, bleeding, or if it is a recent onset constipation in a person above the age of 50, recent onset means, you know, his bowels were reasonably okay for a long time, and of last few months he feels things are not going quite well. There's been a distinct change. Third is that, you know, if the person feels that, look, along with this change in bowel habits, there has been other features like he's been losing weight, for example. So these are what we would consider as significantly alarm symptoms. And there are other subtle alarm symptoms.
Yes.
So one is that, you know, one gets to see blood in the stool with the naked eye, but sometimes it's a little occult in the sense that only on a stool test you find that there is blood, or during an incidental examination of the blood you find that the hemoglobin is low. Now these are some of the situations where one is still suspecting that there could be some blood oozing out of the intestines, and one has to look at it. Along with that, there are quite a few others also. You know, the constitutional parts apart, Dr. Saraya just mentioned that if there is associated pain, I think that is a very important feature. And if it is associated with episodic distension and bloating, you know, which is very suggestive that there could be obstruction occurring. So I think that these are some of the common ones. In short, what I would say is that if it's a short duration symptom, certainly it requires attention, because that is not the way it had been for the last few decades. Why did it happen now? If there are any constitutional symptoms, one needs to take a deeper look. And sometimes even in young people, you know, there are certain conditions called inflammatory bowel disease, which is very important. So it's not always just cancers that we are talking about in elderly, but it's also other conditions in young people. So if there are any of these features which are unusual, it is just good to go and get a checkup done.
So डॉक्टर चौधरी ने बहुत अच्छे से बताया हमको कि कॉन्स्टिपेशन में कब हमको थोड़ा सीरियसली लेना चाहिए, कब गंभीरता से लेना चाहिए, डॉक्टर के पास जाना चाहिए, या तो ब्लड आ रहा है स्टूल में, या दर्द ज़्यादा है, या साथ में बुखार और कमज़ोरी, वज़न कम होना, ये सब चीज़ें हैं, तो आप कॉन्स्टिपेशन को एक नॉर्मल रूटीन में न लीजिए और अपने डॉक्टर से सलाह ज़रूर कीजिए. Dr. Saraya, what are the basic causes? You know, I was reading somewhere that constipation is a mismatch between your lifestyle and your gut. So, what are the basic causes of constipation?
Actually, if we understand the pathophysiology of constipation, then we can understand the various causes as well. You see, roughly 80% is functional and 20% are organic causes. When we say organic, means there is obstruction somewhere.
So organic here is different from the organic you hear about organic food, and this is very different, okay? Organic in medicine means something which has a definite cause, a clear etiology.
Clear etiology. So patient may be having this constipation may be because of some abnormality in the large intestine or a small intestine as well. A small intestine is not an important cause. So if you have some obstruction, some growth, some polyp somewhere in the rectum or colon, then also you may have constipation. Or if there is some narrowing, as we see in tuberculosis very commonly, then also patient may have constipation as the presenting symptom. Apart from that, there may be the motility. You see, colon keep on absorbing water and propelling whatever undigested food is there towards rectum. So if this propulsive movements are impaired, or colon is not being able to push it to the rectum, in that case also we have constipation. So we call it as slow transit constipation. Then again, you see rectum, which is the reservoir where stool comes, and then once you feel urge, you pass that stool out. And this rectum is actually, it initiates the reflex of defecation. So once that rectal pressure, somehow the sensitivity is less, as we see in neuropathy or in myopathy, even in diabetes, in your clinical practice, if you say that 50% patients, they are having constipation, may be having diabetic autonomic neuropathy. So due to that, the motility of colon is also impaired and the sensitivity is also impaired in the rectum. So once that rectum is full of a stool, what happens? It stretches, and then there is a muscle, puborectalis muscle, that also relaxes. So the angle between the rectum and the anal canal, which is around 90 degree, it becomes 110 degrees, so it becomes straight. And the sphincters, anal sphincters, they also relax. So if there is any abnormality, once we say it may be slow transit, there may be obstruction, there may be myopathy, there may be neuropathy, or there may be pelvic floor dysfunction, which is a very important cause. Somehow, rectum is trying to push the stool out, but the sphincters are not relaxing. In that case also, you will have constipation.
So, very rightly and nicely explained by Dr. Saraya about what really causes constipation, and therefore all the described causes can be sort of slotted there. But what about diet and constipation?
You see, if fiber is less, then the bulk will be less.
So less fiber.
So that is also equally important. And there should be adequate amount of water also in the intestine. So if water is less and fiber is less, so bulk will be less, rectal sensation will be less, and so initiation of defecation reflex will also be impaired to some extent. That is one. Apart from that, there are certain conditions. In fact, if patient is taking certain medicines, patient is on antidepressant, or patient is taking opioids or anti-Parkinsonian drugs, anticonvulsants, all these drugs can also lead to impaired motility of the gut. And so that may also be responsible for constipation.
So lack of fiber and lack of fluid or water in our diet, and also medication, can be a major player in the development of constipation. And as I told you, in endocrinology also, people with diabetes, for example, their gut muscles become weaker because of neuropathy. They also tend to have the same motility disorder you were talking about. People with hypothyroidism, again, they come with constipation sometimes. And even conditions like hypercalcemia, very high calcium level, can actually result in constipation because of its action on the nerve and muscle. We'll take a short break here and be back soon with more information about this common problem of constipation. Hello viewers, welcome back after the break, and I go to Dr. Gourdas Choudhuri now. Dr. Choudhuri, we, as I said, sometimes think of constipation as a trivial problem. Some of us think of it as a very serious problem. We've already highlighted some of the causes and some of the warning signs. But can we do some tests to figure out what actually is the cause?
Yeah. So I think the most important is that we usually run a battery just to look at hemoglobin, endocrine causes, as you mentioned, particularly looking at thyroid, calcium and so on. But beyond that, the question in the mind is that is it due to a structural problem, like say for example a colon cancer, or is it just a functional problem, that is say a motility disorder. And the most important test that is usually resorted to in people above the age of 45-50 is usually to do a test called a colonoscopy. Now colonoscopy is a test in which a flexible tube with a eye on the top is inserted into the colon, that is the large intestine, and we have a whole look at the colon after the bowel has been well prepared by a good amount of colon wash. And that actually usually settles the issue that is it something of a very alarming nature or not. So if you have narrowing, you have a cancer, if you have a polyp, if you have ulcers somewhere, tuberculosis Dr. Saraya mentioned, so they all become fairly evident on a colonoscopy. If your colonoscopy is normal, it by and large means that it's not one of those very alarming bad situations, but you still might need to go a little further to find out why is the motility, that is the movement of your colon, is impaired. And then we have a few other tests like anorectal manometry, colonic transit, basically to know whether the colon movement is fine or it's impaired and at what level. So those are more sophisticated tests that we do.
So the colonoscopy is a much talked about test, and in the West, it is part of a general screening for men above a particular age, because apparently colon cancer is more common there, although I'm told, are seeing more and more cases of colon cancer here too. So people should not be scared of colonoscopy. If it's been advised, I have seen patients postponing colonoscopy endlessly and landing up in trouble, and the only problem they had was some constipation and some anemia. So do not avoid colonoscopy if your doctor has advised you to get it done. It's not a very comfortable test, but it's not that uncomfortable also as people think it is. And it can easily be done, and there are experts everywhere who will do it almost painlessly for you and doesn't take much. You can imagine if a test is part of a general health screening, in many populations, it cannot be that invasive or traumatic. So it's very important not to shy away from colonoscopy. But do you believe that normal people should get colonoscopy done? Healthy people?
I think that's a very difficult question, but let me put it in perspective. The incidence of colon cancer in India is actually going up. And that is probably related to our lifestyle and the type of food we eat. See, once upon a time, because we had a lot of high fiber rustic food, so colon cancer was quite uncommon, but now things are very different, especially in metros and big cities. So I think overall, if there's any change in bowel habits, or I think that even otherwise to be it's probably better to get it done above 50. Once your colonoscopy is normal, then at least for the next 10 years, you can rest assured that it's not a dangerous disease.
So Dr. Saraya, there's one concept in people that, I'm constipated and all the toxins are building up in my body. It's a commonly asked question. Sorry, it may sound naive, but it's really a very common question.
Actually,
is there any such thing?
There is nothing like that. In fact, this is a misconception. People generally complain of that because of constipation, we are having some toxins inside the body and that is affecting the functioning. But that is not true. Actually, I would like to add one thing that what Dr. Choudhuri has said. As far as colonoscopy is concerned, yes, we can, if patient is coming with alarm symptoms, then we should definitely do it. Otherwise, it is not cost effective because the prevalence of disease is low, and in that case, it will not be cost effective for our society. In West, the incidence is very high, colonic malignancy is very high, so they are running a screening program. A surveillance program, but here that is not required, number one. Number two, I think there are very simple tests which any physician can do in his clinic. One very important symptom, if person is having continuous urge for defecate, that is also a feature of pelvic floor dysfunction. So if we are doing a per rectal examination and after putting the finger in, if we ask the person or patient to defecate on top of your finger, then you can feel whether the sphincter is relaxing or not. That will give us a fair idea whether patient is having pelvic floor dysfunction or not. So, in that case, management will be entirely different. If on colonoscopy there is no evidence of any organic disease, then we should think in terms of, if patient is having no pain, then slow transit constipation. So, investigation also should be guided by the symptom patient have, and one very important symptom is urge to defecate, whether it is there or not. If that urge is there, that means the rectum is full and sensitivity is also maintained. This sensitivity may be heightened in inflammatory diseases. So, in inflammatory bowel disease, you have that urge to defecate and you keep on passing stool also. So, the sensitivity is also important. Rectum, as I say, that is actually, that generates that impulse. So, we have to investigate every aspect, number one. Number two, as far as toxins are concerned, only if there are methane producing bacteria and they are in abundance and methane is produced, then this methane gas can also slow down the propulsive movement of the colon. To that extent, yes, it can.
It sort of builds up.
Yes, that is there. Otherwise, there is nothing like toxins getting accumulated due to constipation affecting your well-being.
Thanks for clarifying that. हमने बहुत सारा आपको बताया, हमारे विशेषज्ञों ने, कि कॉन्स्टिपेशन क्या होता है. अब प्रोग्राम के अंत की तरफ आ रहे हैं, लेकिन ये तो हमने जाना ही नहीं कि हम करें क्या. तो डॉक्टर चौधरी बताएंगे हमको कि अगर हमें है कॉन्स्टिपेशन, how should we treat it? And then last point will be with Dr. Saraya. How can we prevent constipation and keep ourselves healthy? Dr. Choudhuri.
Yeah. तो अगर ये इफ इट्स ए सिंपल कॉन्स्टिपेशन, जिसको हम लोग हैबिचुअल कॉन्स्टिपेशन या कॉमन कॉन्स्टिपेशन बोलते हैं, आई थिंक द अटेंशन नीड्स टू बी गिवन टू द डाइट एंड टू द लाइफस्टाइल. So 2 or 3 things. One is the fiber intake of the food has to go up. So lot of green vegetables and fruits, especially with skin, like say the apple skin and so on and so forth, jisme what really has fiber in it. Lot of fluid intake so that the body is not dehydrated. And the third thing, I would say the timing of the food, because you know, if you have late dinners, for instance, that really causes a problem. I mean, most people are keen to get a good evacuation in the morning, and if your dinner has been late, you know, the stool has not formed, and then you have trouble sitting in on the pot, and you have an office to attend, so that becomes a problem. It's in fact very commonly occurring now in school children, because they have to get up in the morning and the bus has come and the bowel is not moving. So these are some of the things that one should see. In foods, I have particularly seen that chocolates are very constipating, and quite a few of these fast foods, you know, particularly pastries, chocolate pastries, so they tend to constipate a lot. So these, and last but not the least, is a bit of physical exercise. I think everybody knows that if you are bedridden and sluggish and lying in bed most of the time, so even a healthy person, if he has got a fracture of the leg and he is bedridden, he tends to get constipated. So the bowel movements get affected. So I think doing a little bit of daily exercise is a very important step in keeping your constipation managed.
Fantastic information. And last point for Dr. Saraya. Basically, अगर constipation होता है तो लोग दवाई खाते हैं, सब तरह की दवाई खाते हैं. कोई इंडिजिनस मेडिसिन खाता है, आयुर्वेदिक, होम्योपैथिक, एलोपैथिक. तो दवाई खानी चाहिए कॉन्स्टिपेशन के लिए, लैक्सेटिव्स लेने चाहिए?
That depends. You see, it is important what type of constipation you have.
I'm talking of regular habitual constipation.
Habitual constipation, you just have to train yourself. In case you have to increase, as Dr. Gourdas Choudhuri has clearly said, that you have to increase fiber intake. But fiber intake is not always beneficial if a person is having pelvic floor dysfunction. In that case, this may aggravate the symptoms. So we have to rule it out, number one. Number two, if patient is having obstruction, then also if we are giving fiber, high fiber diet, that may harm, that may aggravate the symptoms. So we have to be little careful, number one. Number two, if patient is having functional bowel disease, in that case, all those things which Dr. Choudhuri has said
But
That is-
laxatives का बताइए.
Laxative, in fact, will help in functional constipation.
ऐसे laxatives
even
जो
in
patient
slow,
अपने आप ले ले, मतलब बिना डॉक्टर से
like
पूछे.
Bisacodil or PEG, polyethylene glycol, that you can take, or you can take even lactulose for that matter. That will help in slow transit or normal transit constipation. In those cases, it will help. Number two, which is also equally important, in fact, apart from drugs, what actually happens if you take food, there is gastrocolic reflex. So, if we ask person to try to strain and pass a stool after taking food, say after half an hour, twice a day, that may build up that type of reflex, and so you keep on having regular bowel movement. That is another thing which we can tell our patient to prevent. And they should take a lot of water. Lot of water, when I say, then that doesn't mean that you take 7 or 8 liters of water, because the whatever amount of water you will consume, that will be absorbed from the small intestine, and very little water will reach up to the colon. So, consistency of a stool will not depend on water intake, but then it should be adequate.
Thank you very much. As it's a very interesting discussion, but we come to the end of this show today, and you learnt about constipation, often trivial but not always. You've learnt about the warning signs, and most importantly, you've also learnt how to prevent constipation, avoid overuse of medication. Basically, as I said, it's a mismatch between your lifestyle and your gut. Thank you very much. Thank you, Dr. Saraya. Thank you, Dr. Choudhuri.